We'll do the nursing care. We just started looking at medicine. Last session we discussed what medicine is. We described the principles of medicine and medical nursing. We looked at some definitions, and we looked at the general way you're going to assess a patient who comes to your unit or to your ward with a medical condition. So now, in medicine and medical nursing, matter of fact, in medicine and in medical surgical nursing, we have a way in which we take care of our patients, and this way of taking care of our patient is a structured way. We have a structured way of taking care of our patients, and we need to be organized as individuals. We need to have a proper plan as nurses. So there are ways in which we take care of our patients. So to make things easier, to take care of the patient, the nurses have come up with a plan, okay? So there is what is known as a prophenema, in which you can follow in taking care of your patients. Now, before we go deeper into looking at the general nursing care, I'll tell you a few ways in which you can care for a patient under medicine and medical nursing. First of all, we have general nursing care, and then we have specific nursing care, and then we have the nursing care plan, right? So the nursing care plan is different from the nursing care. So this is one thing you should put into your head now from now onwards, because now you'll be required to write the nursing care every time there is an exam. So you have to put this into your head that first of all, we have the nursing care, and then we have the nursing care plan. So today we're going to look at the nursing care itself. And so we're going to look at the general nursing care. General nursing care means that it is a nursing care that can be used on, it is a general way to take care of a patient who is suffering from a medical condition. It does not mean that it is not specific to any condition. So every condition has a way in which you can take care of this patient. Not everyone will have a fever, therefore you can't take care of every patient the same way. Not everyone will have diarrhea, therefore you cannot take care of every patient the same way. So a specific nursing care is specific to a particular condition. For example, a patient who has diarrhea should be taken care of in a different way from someone who has malaria. Okay? However, in all these conditions, you still have to consider some general points that you can think about, that you can do to help this patient feel better. And therefore, that is why we're looking at the general nursing care today. And then when you start looking at conditions, you're going to have to start now figuring out which point should go under caring for which condition specifically, so that you get to understand, to know how to take care of these patients. So now, what is the general nursing care? So like I was saying, the general nursing care is a structured way in which we have decided that we will be taking care of our patients. That is the general nursing care, okay? Now, the general nursing care is a proper nursing needs a well-organized individual with well-organized activities. I would say an individual should be organized, well organized, and the activities should be well organized. You don't do things haphazardly when you're taking care of a patient. So in order to be orderly in nursing a patient with a medical condition, in nursing a patient with a medical condition, the mnemonic aprophenema is used. So they have come up with this mnemonic, that is aprophenema. that can help you to take care of your patients. Eprophenema is a mnemonic, meaning that it has letters that can help you come up with subheadings of caring for these patients. All right, so the first letter is A, okay? The first letter is A, and in this case, A stands for EMS. Now, aims are what you intend to do on this patient. Why? In fact, why? What is your objective of doing what you are doing on this patient? Okay, that is what aims are for. You want to why exactly are you nursing this patient? All right, why exactly are you nursing this patient? That is that is what aims are standing for. So the way you write your aims are in such a way that they have to be brief, they have to be concise and to the point, and they have to be achievable. Okay, so your aims should be something like to to uh, to relieve pain. Okay, your aims should be something like to relieve pain. Your aims should be something like to prevent complications, right? So that you have a specific thing you're doing that for. So your aims should be something like to prevent spread of infection. All those are the examples of aims. So aims should be a total of 3 in number, all right? You should write a total of 3 in number, not more. And when you're writing your aims, you shouldn't write less than 3. Now, the one thing that you have to take note of again is that every point you write gives you one mark. So make sure you write according to, so you write points that will give you marks, at least 1 point per mark. You don't have to uh, uh, write halfway. So your ends in this case, okay, should be not less than 3 and should not be more than 3. Okay, they should state why you're performing the nursing care, like I was trying to explain. The next letter in the word eprophenema is P. P stands for position. However, the next word being R stands for room. Now, you cannot put a patient in any position if this patient is not in a room, in the room that you intend to nurse the patient in. Therefore, it is advised that you start with the room. So you put R before P. So room stands for where you're going to nurse this patient, where you're going to nurse this patient. So in this case, we are nursing medical patients. Medicine and medical nursing is about medical patients. Therefore, you're going to nurse this patient in a medical ward. So the example, the way you're going to write your room is you write your subheading, room, and then you write the points that will be under room. So these points will include where you will nurse the patient and how exactly that environment should be. For example, I will nurse the patient, and you should always mention the name of the patient. Do not say, I will nurse the patient like in the notes. Here we do not have a name. Therefore, that is why the notes are saying the patient. But the questions will give you the names of the patient. Okay? So we're saying that you will write your points in this way. I will nurse the patient. I will nurse, if the patient's name is Naomi, I will nurse Naomi in the general medical ward. You have said where you will nurse this patient. And then you will say why you're nursing this patient in the general medical ward. So you're going to say, I will nurse the patient in the general medical ward for easy management, okay? for easy management. Because if you nurse a patient who has a medical condition, you nurse them in a surgical ward, this patient will not be well managed. Therefore, you're going to say, I will nurse this patient, I will nurse Naomi in the general medical ward for easy management. Okay? Now, the other point you should take note of is whenever you're writing these points, you should, one, always say, I will. Okay? Do not just start a sentence and say, nurse the patient in the general medical ward. You are telling someone, who are you telling? It is you who is doing it. So you have to say, I will nurse the patient in the general medical ward. Okay. And the second thing you're going to do, the second point I would like for you to take note of is every single time you're writing a point, you have to put a rationale. Rationale simply means a reason, your reason for doing something. Why you're nursing this patient in a general medical ward, you have to put that reason. And in this case, we say that for easy management, okay? You'll find that if you take, obviously, it wouldn't be normal to take a medical patient to a surgical ward because this patient will be mismanaged or this patient will not even be seen because everyone that you're going to everyone that is going to be going there has a specialty in nursing surgical patients. So you find that you are taking this patient to a surgical ward, they have a medical condition, this patient will be mismanaged, and they may end up even losing their lives, which would be very, very unfortunate. Okay? So always put a reason, a rationale as to why you're doing a particular thing. You can put now things that, for example, how should this room be? So you can include points like, I will damp dust or surfaces to prevent acquisition of nosocomial infections. You see? So this is yet another point, another way you have to write your nursing care under room. So I will damp dust all surfaces. All these are points. Now these notes I'm giving you, they are not the complete general nursing care. This is just a way to show you as an example of how you will be writing your nursing care. From today onwards, every exam that you're going to write will have a nursing care in it. Okay, every exam that you're going to write will have a nursing care in it. Therefore, you have to be very conversant with nursing cares. You can ask for past papers, okay? Answered past papers and see how the nursing care is written. And see how the nursing care is written so that you know and you will be able to ace the nursing care during the exams. So from now onwards, your job is to study the nursing care. After every condition that we learn, you have to go and sit down and make a nursing care for that particular condition. The nursing care is not difficult to make. You just look at the signs and symptoms that the patient is presenting with, and you start thinking of how you can help the patient feel better, of how you can help this patient through their pain, how you can help this patient through their psychological, their psychological problems. Okay, so these are some of the points that will be in the points of under room. Okay, the only subheading that should not have a rationale is the aims. The aims, you don't have to put a rationale. Even if you put a rationale, you'll just be wasting your own time. You can just write to prevent this, to relieve pain, to alleviate suffering, all those kinds of things. The rest of the points, you still need to put a rationale. Okay? Now, the next point is now position. Okay, the next point is now position. Under position now, I'm sure you remember your the positions that you did in fundamentals of nursing. Those come into play now. Okay, so under position, you have to describe what position you're going to put this patient in. What position are you going to nurse this patient in? What position are you going to advise a patient to take? Okay, even as you nurse them. So under position, your position should be something that should make the patient feel better depending on what condition they are suffering from. For example, a patient who is suffering from upper respiratory tract infection or lower respiratory tract infections, any kind of respiratory tract infection, you will find that these patients will be having difficulties in breathing. If they're having difficulties in breathing, the best position for this patient will be Fowler's or semi-Fowler's. If you've forgotten these positions, please go back to your fundamentals of nursing. Go back to your fundamentals of nursing. It's the same thing I was telling you about anatomy last time. When you learn something, do not throw it away. It will come back all the time. So if you've forgotten the positions, go back to your fundamentals of nursing and remember them all, because this time you will now start making use of them. You will start making use of them in class, during your exams, and as you go for your clinical placements. Okay? All right. So this is now where you decide which position are you going to put this patient in? Which position are you going to nurse this patient in relation to the condition that they are suffering from? So, like I was giving an example, a condition of the respiratory tract where the patient is having difficulties in breathing, or a condition of the heart, cardiac condition, where the patient is having difficulties in breathing, you have to nurse this patient in the Fowler's position or semi-Fowler's position. Okay, so you have to figure out, it's not every position, it's not every condition where you nurse the patient in semi-Fowler's. Position is dependent on what the patient is suffering from. Okay, so you have to indicate the best position for the patient in relation to whatever they're suffering from. So you will write your points as an example in these notes. I will position my patient in a semi-Fowler's position in order. Now you have to add your rationale. So why are you nursing this patient in semi-Fowler's position? To promote lung expansion. Okay, if it is a condition of the lungs, so you will say to promote lung expansion. Very, very important. So like I was saying, it should have rationale. I'll put my patient in semi-Fowler's position to allow maximum lung expansion and therefore relieve dyspnea. That is it about the room. And then from room, now, the next point you're going to do is, now room is usually a combination of the room and rest. And now the other thing you should know is from room, okay, room going down, you have to write at least 5 points. Okay, so you write things like I will nurse my patient in a medical ward for easy observations. That is 1. I will nurse the patient in a well-damp, dusted room to prevent upper respiratory tract infections. That is 2. I will nurse the patient in a room that has all the necessary equipment in case need arises. That is 2. So all those points you're writing, they are carrying 1 mark. All right, so for each of the rest of the points under nursing care, you're going to earn 1 mark. So for each of the headings or subheadings, you have to make sure you write at least 5 points under each. 5 points under position, 5 points under room, 5 points under observations, all those should be at least 5 points. Yes, there are some, like for example, position may not have a lot of points, but at least aim to write at least 3, okay? Because one thing I have to emphasize is that the nursing care itself carries as much as 50%. Now, 50% means that that is already half the exam, all right? And the good thing about the nursing care is you know you will have a nursing care. Of course, you may not know which type of nursing care you'll be asked to write, but you know there'll be a nursing care in an exam. So you already have leakage for all your exams under medicine and medical nursing, because you will always have a nursing care in your exam. So it's very, very important that you write the nursing care to the fullest. You write at least 50 points. Now, for you to have 50 points, it means you are writing at least 5 in each of those subheadings. Okay? So under room, you can actually write room stroke rest. Okay, now under rest, you can put things like, I will wear rubber shoes. Okay, I will wear rubber shoes in order to prevent disturbing my patient and therefore promote rest. All right, you can put things like, I will make sure all the squeaking trolleys are oiled in order that they do not make noise for the patient. You should put points like, I will answer phones promptly, quickly, in order not to disturb my patient's rest. You can put things like, I will restrict visitors to visiting hour, all right, in order to prevent the patient uh, uh, from being disturbed. You can also put things like, I will make sure I do related procedures in blocks, all right, in order to prevent disturbing my patient frequently and therefore allowing the patient to rest. This point means that doing related procedures in blocks means that you can do procedures that are almost the same, procedures that are similar. You can do them at the same time. For example, you can go and give the patient oral medication while you have prepared their meal. So as you are going to take the patient's oral medication, you take the meal for them as well. After they take the drug, you give them their food, okay? Or after they have their meal, you give them their medication. That is what is known as them doing related procedures in blocks. That is one block, all right? Or you can do things like bed bath. You do things like bed bath. You do nail care and hair care at the same time. It means you're doing these related procedures in blocks. Okay, you can change linen, do a bed bath, do hair care, do nail care at the same time. Those are related procedures. So that is what that means. So you're allowing the patient to rest. The other thing that I would like to talk about is these observations. Observations is yet another subheadings. Now, under observations, this is where you're going to write whatever it is that you are going to observe on the patient. But the first thing that you should observe are the vital signs. All right, make sure you observe the vital signs, because you cannot start observing other things or nursing the patient if you don't know the vital signs. If the vital signs are not there, the patient could be dead. All right, you could be nursing a body. So the first thing you have to do under observations is to observe the vital signs. All right, so the first point you're going to write under observations is, I will check vital signs. That is, and the other thing I would like to emphasize is, all the time, you should mention the vital signs. Do not ignore mentioning the vital signs because it means you are stinging yourselves of marks. If you just say vital signs, the marker will not know if you know what vital signs are. So you have to say, I will monitor or I will check the first time you're checking the vitals. When the patient just comes to your ward, you will check the vital signs. Okay? Now, this kind of checking vital signs the first time is for the vital signs to act as baseline data. Baseline data just simply means you want to know how the patient came, how the patient was when you just started nursing them. So it is the basis of whatever it is you're going to find after the nursing care has been given. What are you basing your nursing care on? That is, those are the ones that will act as a basis, all right? The next thing you're going to do now is you're going to now start monitoring the vital signs. Depending on the condition, vital signs can be monitored twice daily, can be monitored 4 hourly, can be monitored 2 hourly, depending on how severe the patient is. So you can write, the next point would be, I will check my patient's vital signs, that is temperature, pulse, respirations, and blood pressure twice daily, okay, in order to monitor whether my patient is deteriorating or improving. So you write points like that. That should be your second point. That means you now have 2 marks under observations. The next thing you are going to do to observe now is going to be in relation to the condition of the patient. So anything at all. For example, if the patient has come to you with malaria, it means that their temperature is high, most likely. So you are going to now continue checking the patient's temperature, monitoring if the patient's temperature is reducing or increasing or just the same. You also give a rationale. You observe the general condition of the patient, very important. You're going to observe what is the general condition, how sick is this patient. You're going to observe the general condition of this particular patient, all right? This is in order to assess whether the patient's condition is improving or deteriorating. Depending on the patient's condition, like I'm emphasizing, you have to observe several different things. If the patient came to your ward with a cough with hemoptysis, that means if the patient came to the ward coughing blood, you are going to be observing the patient's sputum, okay, in order to check if there is improvement or not. If the patient came to your ward with diarrhea, you're going to be observing their stool, okay? What kind of diarrhea is it? Is it rice watery? Okay, does it have blood? You're going to be observing. So if, for example, on the first day you observed this stool, it had blood. What about now? Does it have any blood still, or does it not have any blood at all anymore? So all those things should be observed. You observe several, you can observe anything. These are not the only, I'll emphasize, these are not the only points in nursing care. These are just examples. So you observe anything on the patient as long as you give us a rationale as to why you're doing that observation, and that rationale should make sense. Okay? So the P in aprophenema, the second P, just before H, is standing for psychological care. Now, one of the most neglected duties of a nurse is to give psychological care to a patient. Now, these patients that you'll be nursing, some of them will be coming from villages, some of them will be alone, some of them will not have anyone on their bedside, some of them will be scared, they'll be in the hospital for the first time. They've never been in the hospital this is their first ever time to be in the hospital. Therefore, it will be very important for you to take note of that and give them psychological care. Psychological care simply means, how do you make sure this patient feels better psychologically? How do you comfort this patient? How do you make them feel at home? Okay, even though it's a hospital. So that is what psychological care is. Psychological care involves you talking to the patient. It involves you reassuring the patient that you are doing everything within your power to make them feel better. Okay? It does not include you giving them false promises. Do not lie to the patients. I told you when we were looking at the principles of nursing, of medicine and medical nursing, I said that you should not lie to the patient about their condition. You do not know whether they'll recover or not because you're not God. So you are not going to lie to this patient that they'll recover, but you're going to tell them that we're doing everything within our power to have the patient feel better and get back to their best way of life, okay? To their best health. So these are some of the points you can put in your nursing care. So you can put a lot of points. I'll keep emphasizing. You need to look for past papers. You need to look for past papers. If you can't find past papers, please let me know. Maybe I can try and look for some past papers for you. You need to look for past papers and start knowing how to write the nursing care. Otherwise, these are not the only points. Here you include things like how you're going to allow the patient to ask questions, okay? How you're going to call the clergy if this patient is a Christian to pray with them so that the patient feels okay spiritually. Yeah, it's under psychological care. That is where you're going to talk about how you're going to re-emphasize the doctor's explanation so that the patient understands whatever it is that is going to happen to them, whatever it is that the procedures the healthcare team is performing on them. This is where you're going to explain, this is where you're going to talk about how you are going to explain the patient's condition to them, how you're going to give them things to make them forget about their condition, about their pain. Maybe you're going to switch on the TV for them so that they have something else to concentrate on. So this is another point. These are all points that will be under uh, under the um, under the psychological care. Very important. The next thing after psychological care should be hygiene. Okay, after psychological care, we have an F. So there should be hygiene. Under hygiene, you're going to make sure this patient is clean all the time. Okay, so under hygiene, this is where you're going to put things like I will do oral care to prevent halitosis. Halitosis is simply bad breath. This is and under hygiene, that is where you're going to do hair care in order to prevent pediculosis. You under hygiene, you're going to say this is where I'll do my patient's bed bath in order to allow blood circulation or in order to make the patient comfortable. Okay, under hygiene also, that is where you're going to do things like you're going to bed make the patient. You're going to damp dust the patient's unit to prevent nosocomial infections. You are going to make sure the patients, if there's any linen that is soiled, you're going to change soiled linen. Okay, all those are points. And then from hygiene, the next point is nutrition and fluids. Under nutrition and fluids, obviously, this is where you talk about what the patient is going to be given for food. Now, when it comes to nutrition and fluids and nursing, whatever food you're going to give this patient has a function in the patient's body. Therefore, those will be your rationales. So if you're going to give foods rich in carbohydrates, you are going to say, I will give foods rich in carbohydrates, such as white rice, okay, or such as rice in general, okay, to provide the patient with energy. You may want to say things like, I will give the patient foods rich in protein, for example, Carpenta, to promote wound healing if the patient has a wound. You may want to say things like, I will give patients a vitamin-rich diet in order to improve the patient's immunity. And so, like I was saying, there are some conditions where some of these foods may not be allowed. For example, in diabetes mellitus, we do not give a patient food that is rich in carbohydrates, especially those high glycemic index carbohydrates. You may want to make sure you write the correct kind of diet for that condition. In conditions of the kidney, in some of the conditions of the kidneys, the patient may not be allowed to eat food that is rich in things like potassium. All right. So all those things you have to take note as we are learning the conditions. You start taking note to say, in this condition, it's contraindicated to give a patient foods rich in potassium, and so it should be part of your nursing care. It should be one of your points under nursing care. You say, I will restrict the intake of foods rich in potassium, for example, bananas, okay, to prevent the worsening of the condition. So all those should be your nursing care. All right. Make sure you study this nursing care. Make sure you add more points. There are a lot of points. Okay. After N, there is E. That E stands for elimination. Elimination is simply talking about what is coming out of the patient after maybe when they open their bowels. So this is where you observe how much fluid, maybe if it's urine, how much urine they're passing. You have to observe how this urine is appearing. Is it dark? Is it too light? Is it too much? Is it blood stained? You have to observe all those things. You have to observe the kind of stool they're passing. How often do they go to the toilet? You have to observe. This is where you have to observe even if the patient has tendencies of vomiting. When do they vomit? What kind of vomit are they vomiting? Okay, you observe all those kinds of things. You also want to emphasize in this in elimination that you will give foods that are rich in roughage, okay, that will promote bowel movement so that the patient does not have constipation. Very, very important. Okay. The second E, okay, the second E stands for exercise. Exercise can be in two ways. It can be active exercise, or it can be acute. It can be active exercise, or it can be passive exercise. Passive exercises are those exercises that you do for a patient on their behalf. For example, you lift up their hand, you flex it and extend it, and flex it and extend it. Those are passive exercises. Those exercises are usually done on unconscious patients, or patients who are maybe paralyzed in one area of their body, and so you want to exercise that particular part of their body in order to allow for blood circulation. And then you encourage active exercises. Doesn't mean they have to start running. Active exercises simply means the patient doing it themselves. They can be moving around the ward, or they can be lifting and flexing and extending their own limbs. They can be doing deep breathing exercises. So deep breathing exercises is to prevent It's to prevent pneumonia, hypostatic pneumonia. Hypostatic pneumonia simply means the patient has been immobile for some time and so they develop pneumonia. So you find that to prevent that, you have to make sure you tell the patient to be doing deep breathing exercises in order to prevent hypostatic pneumonia. All right? So those are some of the exercises you can do. Passive, they're in two types. They're passive exercises and active exercises. And then the next point is medication, okay? Under medication, you don't put the drugs. This is a very important point. Don't put drugs under medication in the nursing care. The medication in the nursing care is to show, you have to show what you're going to be doing on this patient in relation to their treatment. So you put points like I will make sure I give the right drug to the right patient at the right time through the right route. Those are the points that you should be putting there, okay, in order to prevent complication. You should put points like I will make sure I observe my patient that he or she has swallowed the medication in order to promote adherence. So those are some of the points you will put under medication. Make sure you don't start saying, I will give Panadol 1 gram TDS. No, you can put drugs, but only briefly. For example, you can say, I will administer prescribed analgesics for the patient to relieve pain. Full stop. That is what you do under the nursing care. I'm not saying you will not write drugs at all in any part of nursing. Under the nursing care, you don't have to start writing the drug, the route, the side effects. No, under the nursing care, you just put what you're giving them, when you're giving them, how you're giving them, and why you're giving them. Okay, so those are the things that you're going to be doing. Now, there is now the last point. The last point is A. A stands for I, advice. Advice or IEC. I'm sure you've already been told that every time you're giving a procedure or you're dealing with a patient, before you leave that patient's bedside, you have to give IEC. It doesn't even matter where you are, what you're doing. Every single time you go to a patient's bedside, you have to give them IEC. Okay, so what advice are you going to give to this patient? The advice you will give to this patient should be tailored to fit their condition. If a patient is suffering from malaria, do not give them IEC of hypertension because it will not be useful to them. So you have to teach them about malaria, you have to teach them about prevention of malaria, you have to teach them about drugs, you can teach them anything that pertains to malaria. So that is how you're going to be writing your nursing care. Okay, so this is it about the general nursing care. Please, like I've advised, make sure you find more points and make sure if you don't understand something at this point, you can text me on my WhatsApp line. The other thing I would like to make emphasis on is that there are 3 ways in which nursing care can be asked. A question can come and they'll ask you to write the nursing care of a patient. Nursing care of a patient simply means you start from EMS, okay, all the way up to advice. If a question asks you to write the nursing, if the question asks, in fact, nursing care is the same as nursing management. So nursing care and nursing management are the same thing. If they ask you to write the nursing management, you start from EMS all the way to advice. The second way they can ask you is to write the management of a patient. If they ask you to write the management of the patient, it means they're asking you to write starting from the investigations. You write what investigations you're going to carry out on this patient. You write, the second thing you're going to write is the treatment So that is under management. If they tell you to say, write the management of this patient who is within your care. So you're going to write, starting from the investigations, you're going to investigate what the problem is, and then you're going to give them medication that should be prescribed to this patient. And then you're going to write the nursing care now, starting from those M's all the way up to the advice. That is how you're going to write your management. The other way, the other thing that can be asked is write the medical management. When you're asked to write the medical management, you will have to write only the investigations and the treatment. Do not include the nursing care. And also the other thing that you can do, the way you will know these things, is for the nursing, when they ask you to write the management, you will notice that even the marks that will be allocated to this question will be more. It means they can allocate as much as 50 marks. It means you have to start from diagnosis, you go to treatment, you go to the nursing care, you write as many as 50 marks. The medical management may not have as many marks as that. So you should know that sometimes when they ask you for the medical management, it can carry only maybe 12, 15, or 20 marks, meaning they're expecting you to write at least maybe 6 or 7 investigations. They're expecting you to write the drugs that you're going to give this patient. And when you write the drugs, you have to talk about you have to write the drug itself, you have to write the dosage you're going to give this patient, you're going to write the frequency. How many times a day are you going to give this patient? And you're going to write the route. Which route are you going to use to give this patient this drug? Is it IV or IM or IO or oral or in subcut? All those things you should put into consideration. Okay, so those are some of the ways that you will be asked to write the nursing care. Please, this is not difficult. If you have any questions, you can always text me, and I'll be available to answer your questions. All right. So that is all for today.